Millions of people in low and middle income countries die every year simply because doctors don't have the right medical devices to treat patients or don't know how to use them. During COVID, especially ventilators that help patients breathe were critical. We started our project during the first COVID-19 wave in May 2020 and developed a ventilator prototype specifically for the use in these challenging environments. That means our ventilator must be robust, as easy to use and maintain as possible, and cost efficient. To achieve this, our ventilator uses a simple medical tool, a hand resuscitator bag, and automates it with pedals and smart algorithms to deliver air to the patient. After finishing our prototypes, we traveled a lot in the last years to Kenya, South Africa, Ghana, and Tanzania to work with local experts to improve the device, test its usability with local doctors and nurses, and make sure it really fulfills their needs. One important thing that we learned during this process is that only a device will never solve these problems, but it requires an ecosystem of both devices and appropriate training to improve patient care. As such, our device is complemented by a digital training platform that helps doctors and nurses train interactively in small groups without the need of expensive training equipment. While our ventilator is now closer to pilot production, we are already rolling out our digital training to grow our network and prepare for the ventilator launch. Thanks to the InnoBooster support, we made a big step towards bringing our products to the market and eventually helping to save lives in low-resource settings around the world.